So winter's always been a huge challenge in my 23 years working in the NHS. It's difficult. There's the weather and the impact the weather has on people. There's This year in particular has been a real challenge. There are um, lots of lots of variables and things that we can't change or influence with communications. People are struggling to access primary care services and other services, and there's a that isn't helped sometimes by the quite common perception that you can't get a GP appointment. And some of the research I did, we found lots of people were saying that without even trying. Where the brunt of that pressure is usually seen is at A&E, where people typically do turn up. So there's a number of behavioural barriers and a number of kind of complexities around winter that we've been trying to overcome. Last winter, I led a campaign that ran in southeast London, which where we focused quite a lot on accessing the right service, which will be something that I'm sure lots of you have all done stuff about over the years, and similarly awareness of primary care services. And in the research that we did around that work, we identified these barriers. So something what we call status quo bias. Patients who are used to seeing their doctors in person are still, they may have got a little bit used to not seeing their doctors during the pandemic, but there is still hesitation. There is still, resistance to virtual appointments. There's also resistance to seeing alternative professionals. So, within most GP practices now, there are lots and lots of different professionals working, but still we do know that there are lots of people who are resistant or want to see their doctor and want to see their doctor in person. Then you have something called present bias, which is where patients are really kind of inclined to access services to get immediate answers or almost immediate answers. So they're not keen to wait on the phone. They're not, they don't. We know that lots of people don't like filling in complicated e-consult forms, and these things drive people to go to A&E, where they might have to wait, and they might have to wait a long time, but they're fairly confident they'll get answers the same day. Then you have decision fatigue. So patients may end up choosing to go to urgent care or A&E after they've spent the whole day bouncing around the system in different ways. They've phoned NHS 111 and waited there, or they phoned their GP practice and struggled to get an appointment, tried filling in an e-consult form and not had any joy with that, or not, and then eventually they just give up and go to A&E. And also on top of that, I think there is definitely an element of information overload. So there are so many different health service options that people get presented with that these options aren't always clear, and the right decisions aren't always clear. I do also think there is, I mentioned that we've been talking about this and trying to overcome this for decades. There is a little bit of people being blind to the messaging. Our messaging has been quite similar, particularly around the in the right service for quite a long time. So I mentioned lots of variables that can make it difficult to measure in terms of how our communications are impacting some of the pressures in health and social care. But we do know that taking a behavioural science-led approach can change people's behaviours, particularly when it comes to public health. We've seen that in other areas. But what I think is really key and really important here with these sorts of campaigns is that this takes good planning. It's not something you can just turn on and do tomorrow or next week. And to change these behaviours, it can be a real slow burner. You invest your time and effort and money to see the results perhaps quite a bit further down the line. So we've talked quite a lot around planning and funding. And, you know, I've been there myself in many times over the years, and I'm not going to kind of draw on particular examples, but, you know, it's difficult to plan and to have impact when your budget gets confirmed right at the last minute, and you don't, you know, and you almost plan to do stuff with no budget, and then often all of a sudden a budget materializes and you're running around looking at how you might spend it and how you might spend it to have some impact. What we really want is senior leaders and integrated care systems to agree the funding for next year by July, say, would be really helpful. This would enable us to plan properly, to implement in a way that we're really kind of maximizing our impact, you know, to test our messaging, make sure it resonates with our audiences, and to, you know, develop effective comm strategies and tactics.
If you're asking for activity in autumn and winter, and you're asking for that pre-summer, your chances of success, chances of opportunities to collaborate are much greater. With cost of living communications, with active transport communications, with a whole range of different campaigns, these things will be always on and planned way in advance. So being able to integrate with those campaigns is really important. So I think it's understanding the behavior that you want, having data that backs that up, but also giving people the why. And a really important part of why is, well, how did it work last year? Also getting maybe third-party analysis or assessment of the impact of last year's campaign could be something that's quite interesting, that could start a conversation much sooner. One thing I just wanted to show you that is another tangible source of data that you might be able to use to convince people is search advertising. This is data for England-wide, but we can zoom in on any specific location for you, and then look at historic search data in that geography. So here we've looked at people searching for hospital, ambulance, accident emergency department, A&E, pharmacy, GP and GP surgery. And this tells us the kinds of volumes you get on a monthly basis. Now, we can see recently vast increases in searches for pharmacy. Now, this, I suspect, is a result of some of the good work that you guys are doing in terms of promoting pharmacy as a route to care. But it also helps us understand at a local level what people are searching for and when. Now, this is useful for showing to senior managers what is on the minds of residents, and also maybe justifying why messaging needs to be of a certain form and maybe not of another form. And that's how we recommend using this data. But we can also zoom in on very specific terms. This, for example, this yellow line here is people searching for Calpol. And you can see here in March 2021, you know, a huge spike in searches for Calpol, I believe, when there was a threatened shortage of it. We can zoom in on terms relating to baby temperature, things like that, to identify in any location what's on people's minds. You can look into cold and flu, look into things that we know trigger unnecessary trips to A&E, for example, asthenia, fever, and also examples of other things that maybe you do want people to go to A&E for. So this shows you certainly what's on people's minds and what people are thinking about. But then what you can do is you can intercept those searches with search advertising. So I'll just show you very quickly what I mean. If I'm typing in healthy temperature for a child, there could be an advert here nudging me towards, you know, if you have a fever, if you're worried about child's temperature, here are the steps to take, you know, self-care, staying at home, and various other things, basically routing people away from some of the more expensive, less efficient channels. So we can run that search advertising, and in some locations we are. So this is some activity that we're running in across the 6 northeast London boroughs, trying to intercept people typing in certain search terms and then nudging them towards signposting, information that helps them either self-care or go to other locations. Now, this campaign's live and has been running throughout winter in North East London. But I just thought it might be worth showing you what you can see and what you get back. There's a lot, you can see here around mental health crisis, depression symptoms and things like that. So this is covering, yes, the pathways and the A&E demand, but also, the emerging pressures around anxiety and depression related potentially to the cost of living and so on. So this is an example of something that you could be positioning in front of the senior decision makers to say, well, look, if we start earlier, we can see what people typed in last year and what people were searching for, and we can develop plans with you now that will mean that that signage is in the right place at the right time for you.